President Trump's nomination of Robert F. Kennedy Jr. to head the Department of Health and Human Services has ignited a firestorm of controversy. Kennedy, a well-known environmental activist, is a contentious figure. His stance on vaccines has drawn intense criticism from the medical community. If confirmed, Kennedy would oversee crucial aspects of the American healthcare system, including Medicaid, Medicare, and the Affordable Care Act. The Senate held its first confirmation hearing on Wednesday, January 29, 2025. The hearing lasted for 3.5 hours. Senators grilled Kennedy on a range of issues. Further questioning is scheduled for Thursday, January 30th, 2025. Kennedy's grasp of Medicaid became a focal point during the hearing. He made several inaccurate statements. He claimed that Medicaid recipients pay premiums and deductibles. This is not true. Kennedy also expressed skepticism about Medicaid's effectiveness. He argued that despite a budget of $900 billion, health outcomes for Medicaid recipients are worsening. He called for pilot programs, value-based care, and increased transparency and accountability within the program. Kennedy suggested improvements through telemedicine and AI. However, Kennedy's views on Medicaid contradict public opinion and research. A 2023 poll by the Kaiser Family Foundation found that the public generally views Medicaid favorably. Studies have shown that Medicaid expansion is linked to reduced mortality rates and improved health in older adults. One study, published in The Lancet in 2022, highlighted these positive impacts. Kennedy's comments on Medicare also raised eyebrows. He suggested that more Americans might prefer Medicare Advantage. This statement hints at potential support for privatizing Medicare. Medicare Advantage plans are offered by private insurance companies. Dr. Mehmet Oz, also nominated by President Trump for a key healthcare role, has openly advocated for Medicare privatization. Oz's nomination is for the Centers for Medicare and Medicaid Services. Kennedy's history of controversial statements about vaccines loomed large over the hearing. He has previously claimed that no vaccine is safe and effective. His former organization, Children's Health Defense, sold merchandise with anti-vaccine messages. Senator Bernie Sanders directly questioned Kennedy about this merchandise. Senator Ron Wyden confronted Kennedy about his contradictory statements on vaccines. While Kennedy stated his support for vaccines and vaccine access, his past statements continue to draw scrutiny. Senators from both sides of the aisle expressed concerns about Kennedy's nomination. Senator Bill Cassidy, a Republican, joined Democrats in questioning Kennedy's understanding of healthcare policy. Senator Wyden remained unconvinced by Kennedy's arguments, stating that he was peddling half-truths. Senator Michael Bennet echoed these concerns, accusing Kennedy of lacking a firm grasp of critical healthcare issues. Section 6. The weight of expertise, opposition from the medical community. The medical community has voiced strong opposition to Kennedy's nomination. Over 15,000 medical professionals have signed a letter urging the Senate to reject his nomination. Additionally, 75 Nobel laureates have expressed their concerns. They argue that Kennedy's views on vaccines are dangerous and could undermine public health. Section 7. Public trust in the balance. Kennedy's nomination has sparked a national debate about the role of science and expertise in government. His critics argue that his appointment would erode public trust in public health institutions. They fear that his views on vaccines could lead to a resurgence of preventable diseases. Section 8. Awaiting the verdict, the future of Kennedy's nomination. The Senate is expected to vote on Kennedy's nomination in the coming weeks. The outcome of the vote remains uncertain. Some Republican senators have yet to publicly state their position. The hearing has highlighted the deep divisions in American society over vaccines and the role of government in healthcare. Section 9. The unfolding impact on public health leadership. Kennedy's confirmation or rejection will have significant implications for public health leadership in the United States. His nomination comes at a critical time. The country is still grappling with the COVID-19 pandemic. The next HHS secretary will play a crucial role in shaping the nation's response to future public health crises.